The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to our February 10 Safe and Calm webinar. This is Deanna Mitchell with LeadingAge Michigan. This morning, we're very happy to report that the numbers continue to show us that COVID transmission continues to decrease across the state, so that's very good news. Hopefully, visitation will follow. So on this morning's agenda today, we're going to follow our standard routine, and we'll be starting with an advocacy update from Dalton. He will focus on our strong visitation advocacy, which we're sure is uppermost in everyone's mind, and along with the upcoming budget discussions. Then we will take a quick look at the numbers, and then finish with a number of CDC communications, information from the White House COVID advisory advisor, and along with some general updates. So with that, we will turn the presentation over to Dalton, our Director for Public Policy.
Good morning, everyone. As you know, if you were on last week's call, we sent a letter regarding visitation to the governor. I have a copy to the right, but we sent a similar letter with some smaller changes, but the data was largely the same, to the Speaker of the House, Jason Wentworth, Senate Majority Leader Mike Shirkey, Chairman of Senate Health Policy, Curtis Vanderwall, and the Chairwoman of House Health Policy, Breonna Kale. We're hoping to use these letters as a way to start some more, we'll say, formal meetings than just kind of the informal meetings that you have around the time. So we're hoping to get some formal meetings set up with them. We do understand that this issue largely stems from public health orders from MDHHS and the governor's area, but we do think generating any kind of support we can get to get this visitation ball moving is important. Just like the last letter, the letter focuses on vaccine efforts, the well-being of seniors, and following up the work group recommendations from the governor's task force that she had, earlier in the pandemic is what I'll say. So kind of the big talk of the town in Lansing right now is that the budget recommendation is going to be tomorrow. So every year, the governor usually starts off budget negotiations by presenting what they would like the budget to look like for the next upcoming fiscal year. So tomorrow, the governor will propose her budget to a joint committee of the House and Senate Appropriations committees. They just get together so she doesn't have to present it twice, is essentially what goes on there. These signal the start of the budget negotiations for FY 2021. The budget in the state needs to be signed by October 1st to avoid a shutdown. We've been pretty successful even with contentious politics in the past, so I don't see why we would get any more close. And they're starting pretty early by starting in, the second week of February? So pretty early. Last year she presented it the first week of March, so we got a couple extra weeks. Some interesting things about this year: the governor has not revealed any kind of information outside of what she said in State of the State. Normally, during the normal process, she does kind of reveal a couple of things, but this year she's been awfully quiet. And I largely believe that's because so much is up in the air, and politics being what it is right now. No one kind of wants to get too far ahead without having it in a formal kind of public space. Two of the things she did talk about at State of the State, which we do expect to see funding for in her budget, is a shift to make the $2 an hour for direct care workers a permanent program, and expanding the Future for Frontliners program, which is that program where direct care workers can get some funding for secondary education through college or licensure programs. And so the rest of these slides are really going to be setting up what the numbers look like for the budget. So then next week when we go over her recommendation, we kind of have a nice background here. So every year there's 2 consensus revenue estimating conferences, and this is where House Fiscal, Senate Fiscal, and the Treasury Department come to agreement on what the state's monetary outlook looks like for the upcoming year, and then they project usually 2 years in advance. COVID kind of threw this off last year, so they had an additional date in August, so they did the 3 last year, and this was largely because obviously the kind of drastic economic change in COVID and a large amount of federal stimulus dollars coming into the state. So they added another date last year. So I put together some graphs coming up that you'll see, and they'll have August on there, but do note that that was kind of a one-time conference that was held. Some good news in general coming out of the conference. COVID has had less of an economic impact than the original projections showed. They believe this is largely due to federal stimulus dollars, unexpected increases in income tax revenues at the state level, and some unspent federal funds were actually able to roll over into the upcoming budget. You may have heard some debate going on in the last week about these funds because the legislature did not fully allocate all of the funds in their first spending bill, but do know that they are actually, the bills came up yesterday to spend the rest of the funds. But these funds are largely for school funding. I think it's something like $600 million in one-time rollover revenue that they can bring into the next fiscal year. And so what are the exact numbers here? Well, I have presented these in previous slides, but just a reminder, or previous days or Safe and Calm webinars, just a reminder that the general fund and school aid fund is $1.23 billion higher than it was projected in the August revenue conference. That's $700 million in the general fund that they weren't expecting, and $528 million in the school aid fund. It's important to note that long-term care and most of the health budget is in the general fund section, not the school aid fund section of the Michigan budget. There is a structural budget deficit that currently exists for FY 2023. And what this means is just that the level of government spending in 2023 is expected to be higher than the prevailing tax levels. Obviously, before 2023, the legislature and the governor can work out how they want to solve the structural deficit, but do know that there is going to have to be some kind of adjusting when we get closer to 2023. So I put together these charts to kind of give us a visual picture of what's going on, which I think really helps. So the green bar here is what was projected pre-COVID in the January 2020 estimated revenue conference. The blue bar is what they projected in August. So this was kind of during COVID. And the gray bar here is the January 21, so the one that just happened last month, so kind of where we stand today. So you can see pre-COVID, we were expected to be much higher than we are right now in January. But compared to August numbers, we're still up. So because the legislature acted on these January and May and August data via supplemental budgets and state budgets, they're looking pretty hopeful for this upcoming budget session or budget negotiations because they have more money than they thought. So there won't have to be any cuts because they already kind of made them, or were able to be backfilled with federal stimulus dollars in one-time spending. So the upcoming negotiations aren't expected to be too contentious because there's not supposed to be a lot of cuts. So that's good. And then I put here, you can just see where we're expected to be in January 2023. We're expected to go up slightly. Well, that last slide was total budget numbers. I did want to highlight the general fund estimations separately, since this is where we all get our funding from. Do note that the scale changed because this is less than half of the budget typically. It is the biggest part of the budget, but there's so much that goes into the total budget that it's just less than half. So we're talking tens of millions here, not $20 million, et cetera. The August numbers are still in blue here, and the 21 estimations are in gray here. So you can see in FY21, we're up roughly $700 million. And then in FY 2022, we are up $500 million-ish compared to what they thought mid-COVID. So there's a positive outlook kind of going around Lansing, and we expect these budget negotiations to be a little less contentious.
All right, thank you very much for that, Dalton. Let me go ahead and pull the questions up here really quick to see if we have any. All right, so as of right now, it actually does not look like we have any questions. So thank you very much for that, Dalton, and we will continue on.
Thank you, everyone.
Yes, thanks, Dalton. So let's take a quick look at the numbers. We have been sharing updates of this CDC map for the last few weeks, and it's updated daily on the CDC website. As of Monday, it shows the average daily cases per 100,000 persons across the states, and it uses a 7-day rolling average. So you can see that Michigan continues to fare well, although we must note that several states did become quite a bit bluer in the past week. And you can see that in the South, especially on the eastern side. This is the CDC graphic that monitors the spread of variant viruses in the US. We moved from 541 cases last week to 690 cases nationally this week. But the numbers in Michigan have remained consistent at 29. And all to date have been related to the B117 virus, which is the UK variant. However, you know, it is expected that these other variants are going to eventually spread to Michigan as well. When looking at these caseload numbers for Michigan using, again, the 7-day rolling daily average, you can see continued declines. Still not quite as low compared to mid-June. But hopefully it will continue to get to those levels soon. When looking at the deaths, they appear to be stabilizing, but in reality, the number of deaths for the past few days were very, very low. But since this is a 7-day rolling average, the deaths added late last week from review of death certificates by the state public health department kind of inflated those numbers. And so it changes the overall graphic look. Hopefully, we will see the trend from the past few days continue. And those numbers were actually in single digits. So hopefully that will continue on. Here are the CMS county positivity rates. And we have to remember in looking at these that there is a lag period. And this graph shows information through 2-3. In the past week, the number of counties in red has declined, and increases are noted in the number of green counties, as you can see on the far right side of the slide. Looking at the My Safe Start map, however, there are still 50 counties, as posted yesterday, who are at level E. Only 2 counties are over 10%, and that is the level for visitation restrictions by CMS. 38 are between 5 and 10%, which if we were using CMS guidance would be allowed general visitation. For long-term care facilities, these weekly numbers are updated every Monday. And as of that date, here you can see continued declines in the number of SNF new cases here in Michigan. And very quickly for the next 2 slides, which are HFAs and AFCs, you'll see the same kinds of declines. Here for HFAs, and the next slide includes AFCs. And when looking at the total distribution of Michigan long-term care related cases, you can see that although everything is slowed, we still have passed the 43,000 mark for total cases between residents and staff, and are hovering around 5,500 total deaths. So those are the numbers as we know them, and we're going to move on to our general updates and a few new pieces of guidance. So this morning we're going to start with CDC updates, and they have, I think this past week, it might have been late last week, but in the recent past, they have refined their website for vaccine tracking. And according to this, you can see that over 42 million doses of the vaccines have been administered nationally. And that means that over 35 unduplicated persons have received some doses, and 9.5 have actually received a second dose. In Michigan, and these numbers are reported from the CDC for Michigan, so they may not exactly match the state reporting. We have provided over 1.2 million doses, and that's very close to the number per 1,000 that most other states have done as well. They're pretty much very level across the states. It's a very consistent number of doses administered per 100,000 persons. The CDC is also tracking caseloads and deaths state by state and comparing it with national averages. You can see that we've had a 21% decline in caseload numbers just across the past week. And our case rate average per 100,000 persons is, which is 109, is much lower than the national average of 263. Our state test positivity rate is 4.8. Again, a bit disconcerting since visitation is still closed over much of the state. And our death rate shows both significant declines and a rate, again, far better than the national average. They also report SNF comparative data, and you can see that we right now, again, have much better rates for all those indicators and better hospitalization rates too overall. Now we're going to move on to some general CDC updates and resources. There are CDC resources on emergency and disaster planning, and they have updated that resource to talk about how your overall disaster and emergency plans can be adjusted because they can in and of themselves be affected by the pandemic. So everyone should have updated their emergency plan to include COVID in their planning, but also the CDC is recommending that your general plans for disasters and emergencies should also have been updated to include the impact from the pandemic. So the link for that guidance to do that is right here. The surge mitigation strategy has also been updated, and this is really a hospital-related guidance in general, but it does speak to the use of long-term care facilities for relief facilities as well. There is a small update to the information about exposures for healthcare personnel, with a reminder that although there are recommendations for decreasing the time of quarantine for some exposures, for healthcare personnel, the recommended quarantine is still 14 days. In terms of variants, there are updates on the descriptions of each kind of variant on the CDC web pages, and also, lastly, there's general information on the virus, the characterizations of the virus for healthcare professionals as well. And all links to those guidances are on this page. Last week, we were fortunate to get an early release of the copy of the CDC FAQs for the Pharmacy Partnership Program. These have since been posted, and we have summarized much of them here. First, the CDC wants everyone to know that the state holds the final decision about whether or not first doses can be delivered at the third clinic. The CDC recommends that providers should be continuing to vaccinate every person that they can. But we have not heard anything definitive that Michigan is not allowing those doses at the clinic, although we have heard some rumors that some pharmacy clinics are not doing that. But the CDC is leaving that decision up to individual states. Additionally, when thinking about moving forward with vaccination, the CDC has identified that if someone gets their first Moderna dose at a third clinic, providers should check to see if their regular pharmacy will have access to vaccines. Some local pharmacies may have some access to vaccines in the next few weeks. Following that, the next step would be to find a retail pharmacy provider. And some of those pharmacy providers are scheduled to get vaccine doses in the next week or shortly thereafter. And of course, the last recourse is the local health department. And remember that the storage requirements for the Moderna vaccine are less stringent, so it might be easier to find some of those vaccines among the retail pharmacies or local pharmacies. But if the first dose during the third clinic is a Pfizer vaccine, that's a bit harder because many of those local pharmacies will not be able to stock the vaccine because of the ultra cold storage requirements. So the CDC suggests that staff should contact CVS, Walgreens, or retail pharmacies who are listed to carry the Pfizer vaccine to try and schedule doses outside of the vaccine clinics themselves and most likely not on site. And of course, then the last recourse is to call the local health department. We do note that it's a little bit easier to schedule a second dose if the first dose has been given. The CDC wants to ensure that these opportunities should apply to residents who may have been discharged, especially from a SNF short-term stay, before their second dose. If local options for finding Pfizer vaccines outside of the pharmacy partnership clinics, if local options are not available, providers might consider, and this is according to the CDC, might consider recommending the Moderna vaccine, which might be easier to find in the future. And lastly, and this is an exceptional and last resort, the CDC says there could be a second dose of a different mRNA vaccine product provided at least 28 days, but not more than 42 days later. So right now, the Moderna and the Pfizer vaccines are both mRNA. Other vaccines coming down the pipeline are not, but you could follow up with a different product, but we would recommend that that only happen with consultation from the local health department and perhaps some infectious control people. Members should also remember that after the clinics have ended, you should be working with a local pharmacy who is enrolled as a vaccine provider. Some of those retail pharmacies, if not your own personal pharmacy, and a list of the retail pharmacies who are enrolled are included in this link here on the page. The CDC plans to provide more information about follow-up plans for those vaccines shortly. They also note that the Pharmacy Partnership Program was never meant to be the source for vaccinations over the long term. They were really meant to just jumpstart the program. LeadingAge in Washington is asking that the list of included retail pharmacies for follow-up also identify if they are willing to provide on-site clinics. And so the CDC is considering that. And lastly, of course, LeadingAge does have a vaccine FAQ document. It is frequently updated almost every day. And the link is here on the page, and that's a great resource to find out what's going on with vaccines. We're going to take a moment and pause for questions.
All right. Thank you, Deanna. Right now, we actually only have one question. Are we still required to enter all employee COVID tests in the NHSN site?
I believe, although I haven't heard a lot about this lately, and there haven't been a lot of questions about it, so I haven't been as engaged in the conversation. But I believe at this point, the state has updated its work and is forwarding the information if you're putting it into EM resource, if you, of course, you're a nursing home. I did hear maybe a month or two ago that some people continued to report in both systems because they didn't feel that the data was consistently transmitted from MDHHS, but my understanding is that it does. However, yes, one way or the other, that reporting is still required.
All right. It actually looks like that was the only question right now, so we can move on.
Okay. This week, we came across a Kaiser Family Foundation report on the vaccine rollout. They noted that persons older than 65 account for over 75% of all deaths. But they raised concerns because all states have not expanded access to vaccines for 65-year-olds and plus. Michigan has done that, and at this point in Michigan, about 22% of all persons in Michigan age 65 and older have been vaccinated at least with the first dose, which compared to other states is pretty good. And the report also notes that in Michigan, 46% of all vaccinations have now gone to persons age 65 and older. The link to this report, which is kind of interesting, it's at the bottom of the page, and it was issued on February 8th. Another report issued this week, in fact, it came out yesterday, is about the impact of dementia by COVID outcomes and on COVID outcomes. This report found a higher risk for hospitalization related to COVID for persons with dementia and Alzheimer's disease. And also, as you can see from the graph on the left, a much higher risk for mortality. The blue bars on the slide, and I know that the slide's a little bit hard to see, but the blue bars represent African American mortality and deaths as compared to white persons. So you can see that the high risk for dementia and Alzheimer's disease and mortality and death related to COVID is not only greater overall, but it's even greater in African American populations. The researchers also believe that there could be significant long-term effects from COVID in some persons, and that persons with dementia might be worsened in cognitive function directly from the virus, or that COVID can actually trigger dementia in some persons. Of course, because of the limited time span, they're going to have to review this further over time. So we thought we would spend a few minutes this morning going over the American Rescue Plan draft that's being debated in committees currently in the U.S. Congress. The majority of the provisions that we care about come from the Ways and Means Committee. It's kind of interesting when they have a large bill package like this, different sections of the proposed bill will come from specific different committees. So the Ways and Means Committee, their provisions provide relief payments of $1,400 to working families They extend unemployment benefits with enhancements in payment. They talk about tax flexibilities for families, along with some healthcare subsidies for certain persons. One of the provisions is intended as written to provide SNFs the tools and support needed to contain outbreaks. But that does not necessarily mean any provider relief funding, but it seems to be a set of standards for infection control that is supposed to be developed by the QIOs, and perhaps some more funding for strike teams. But when they talk about support, they're not talking about provider relief funds, unfortunately. There are no provider relief funds right now for aging services in this bill package at all. There is some additional funding for service to combat abuse, neglect, and exploitation. They consider that those concerns and issues may have been made worse by the pandemic. But again, mostly, it does not extend any provider relief funds, although LeadingAge increases advocacy to ask for $50 billion in the package for aging service providers, affordable housing, and home and community-based service providers. The link to the Ways and Means press release on these issues is at the bottom of the slide. The Education and Labor Committee sections talk about raising the minimum wage to $15 by 2025. We do know that that has been a long agenda item for some groups. It is a slow implementation over several years. They're looking at additional OSHA worker protections, some funding for Elder Justice and Older Americans Act programs, and provider relief for institutions of higher learning. The Financial Committee section includes excuse me, monies for homeowner assistance. $10 billion is earmarked for use of the Defense Production Act to boost production of PPE, vaccines, and testing. And LeadingAge is asking for money specific to HUD-assisted senior housing. The Small Business Committee, and this is something pertinent to our members, is looking at more money for PPP loans and expanding the eligibility for not-for-profits. Some of the rules for the PPP loans have made it hard for some not-for-profits, and so they're making that a little bit more flexible. So a summary of the entire bill, as it is proposed right now, is on the LeadingAge website, and the link is there. And again, they want to ensure, LeadingAge does, that there's provider relief funds for all aging service providers included here. They continue to advocate for that. And they want $10 billion specifically for Medicaid, home and community-based services, which in Michigan would mostly mean the My Choice waiver and PACE. Overall, the other issue that they are advocating for is to ensure that the FMAP increases, where the amount of money that the feds give Michigan in terms of supporting Medicaid would actually have to go to those services, that those additional Medicaid funds should go to those services rather than just fill up some of the budget deficits, which many states have done. So that is one of the other things that LeadingAge is advocating strongly for. So last week, LeadingAge was able to have a conversation with Andy SLAVITT, who is currently the White House COVID-19 advisor and who was the director for CMS under the Obama administration. And they talked a lot about the work of the White House in moving the COVID program plans forward. Basically, he reported that although obviously the demand for vaccines continues to outstrip supply, they are currently administering about 1.4 million doses per day, and that's roughly a 9.4% increase in the vaccination rate. And they, at this point at least, are increasing vaccine production almost every day. They do acknowledge and recognize the significant confusion in how persons who are currently in priority groups allowed to get the vaccine, but the confusion about how to go about getting it. And they're working on ways to improve that and communicate better. They note that a barrier for many is that a lot of seniors don't use technology, and a lot of the access does come from the computer internet. They're also looking at deploying mobile units for underserved areas. They are going to apply 1,000 more active duty personnel through the National Guard to assist with vaccinating some populations. And they're planning on using the Defense Production Act to provide Pfizer specifically with more equipment and more supplies so that they can ramp up vaccine production. Because it isn't just how much they can produce, sometimes the supplies for those vaccines have been deficient as well. And also, they plan to use the Defense Production Act to support more PPE production. LeadingAge has come up with a few new tools and resources that they've released in the past week. They also want to note that on February 11th, tomorrow, on their Thursday call, remembering that their calls now are on Monday, Wednesday, and Thursday at 3:30 p.m. They're going to be hosting tomorrow Evan Schulman, and he is the director for the nursing home group at CMS, and he will be responding to issues about and questions about visitation. However, LeadingAge does anticipate that there may well be no more specific changes to the CMS guidance. And we do know that Michigan has stricter rules than that anyway. LeadingAge has also published a toolkit for reopening activities. They're not talking about reopening in terms of visitation. They're talking about expanding group activities safely. And they have in their toolkit a lot of training, sample policies, and procedures for that. And they also have a new toolkit about accessing PPE, policies, procedures, and training related to PPE as well. Additionally, LeadingAge has been working with Pathways to develop some additional toolkits, and they now have resources for universal source control and physical distancing toolkits. Excuse me. And they have also updated some of their previous toolkits on testing and vaccination. So those are things that you might want to look at and look at again if you have in the past, because these toolkits have been updated. And the links for all of those resources are here on the page. And of course, a few other general notes related to COVID, the Medicare sequestration. If you remember, that's that 2% reduction in Medicare payments that was started years ago. It's been on hold during the pandemic, but it ends in March. And LeadingAge is currently advocating to continue it. We've not heard anything from the feds about that yet. We also note that there's a new report out on staff stressors and disparities. And some of this information can well apply to staff issues who are perhaps combating ongoing stress as well. We also want to note that the American Medical Directors Association has issued a statement that they believe that all short-term stay nursing home patients should continue to get a first dose of the vaccine on an ongoing basis, if not during hospitalization before they come to the nursing facility, but definitely before leaving the skilled nursing facility. Last on this slide, the NIH, the National Institute of Health, has issued a new report on community immunity. That is a discussion of safety precautions based on the use of vaccines and other immunity, and it is a rather interesting report. NDHHS has been providing brief programs, mostly on vaccines, intended for all audiences, but geared to healthcare workers, including frontline healthcare workers. This week, they were focused on a safety update concerning the vaccines. The next program is scheduled for tomorrow at noon. The link for the program is here. They tend to be fairly short, and there are Q&A opportunities. Registration is not required. This is the link just to sign on. Our last note today is for nursing homes. The department had issued a provider letter in the past that extended flexibilities for doing the recertifications for the level of care determinations, and that extended those flexibilities through February 28. Persons with an LOCD end date between November 1 and February 28 have an additional 180 days to complete those recertifications. We have yet to hear that there's an extension for this, but we're looking for it. It's important to note, though, that overall, based on CMS rules, there cannot be any extension for any level of care determination beyond or after 365 days beyond the original due date. So there are only certain people over time that are going to be able to be extended. And level of care determinations continue to be required for any significant changes in condition. So that's all we have today. Let's see if there are any questions.
All right, thank you, Deanna. We just have a couple questions here. Is there a time frame to continue staff testing who have received the vaccine?
There are no changes for testing for anyone who's received the vaccine. I believe that the state and both the feds are going to look at that based on the community transmission rates and not vaccine administration.
Oh, okay. Is anyone advocating for allowing lost, excuse me, I'm just going to start over here. Is anyone advocating for allowing lost revenue and increased expense submissions for Q3 and Q4 so those amounts can be considered for provider relief funding? Phase 3 only collected data through June 30th of 2020.
I am not sure of that. Perhaps Dalton is more aware of that. Dalton, do you have an answer?
I actually haven't heard anything about kind of the future of PRF funds outside of what has already been established. We'll see what goes on at a national level in terms of further funding, but I haven't heard anything right now.
We'll take that question and review it, make sure that we will look around to see if there is anything, but I'm not aware of anything either.
Okay, so with that, that actually looks to be like it is our last question. So if you do think of anything after this webinar has concluded, as always, you can email safeandcalm@LeadingAgeMI or Dalton and Deanna at leadingagemi.org, and we will make sure to get that question answered for you. So at this time, we would like to thank both Dalton and Deanna, and we would like to thank our 85 members and participants that took time out of their busy schedules to join us for today's webinar. We appreciate everything you do each and every day to support your staff and provide quality care to your residents. We are grateful for your continued support, and we are here for you when you need our assistance and resources. So with that, we will conclude today's webinar, and as always, we will see you next Wednesday. I believe it will be the 17th at 10 a.m. Eastern Standard Time. Thank you and have a great day.
Goodbye, everyone.